Dr. Ghatan, does funguses or a fungus have anything to do with the skin, and is there something a dermatologist like you has authority over?
Well, it's a very common skin problem. There are different kind of fungal infections, yeast infections, and we deal with them on a daily basis. Basically, the most common fungus infection is athlete's foot, as you know it, or what we call tinea pedis.
Okay.
You don't have to be an athlete to have an athlete's foot. But if you do wear shoes for say 12, 14 hours a day, and it doesn't matter if it's summer or winter, you do sweat in there, and you're going to have a moist environment, and you're all exposed to this fungi, then you're more likely to get fungus. So we do advise the patients not to wear shoes for so many hours at a time, to wear leather shoes and cotton socks. We see a lot of stickers nowadays, but they look beautiful, they look very presentable, but they're very occlusive. Patients, sweat in there so much, and it gets so warm in there, you can fry an egg inside there. So it's a good idea to air the feet. I tell the patients, if you can't do it today, take your shoes off, let it air for a minute or two. The other thing you can do is to put some powder in there, even baby powder, and that increases the surface area, and it helps with the sweating and keeps the feet cool, and in some ways it helps with infection.
Looks like a catch-22. If a person knows he's sweating, he probably knows he has smelly foot, so the last thing he wants to do is take them off when be it in an airplane or in an office or wherever, because, that's just not so good. So he's like between a rock and a hard place here, looks to me.
That's correct, but we do have treatment for the smelly foot. We do propose to the patient to apply solutions that easily can take care of the smelly foot, and then they go on, with putting the powders and keep it dry. But I want to also mention a very important issue here, and that is fungi. And a lot of us have the fungus on the toenails. This is called onychomycosis. Fungus infection of the nail. This is quite common. Sometimes it does hurt because the nail the growth is abnormal, and the nail becomes thick, and it sometimes goes into the flesh and becomes painful, and sometimes it's so thick it's very hard to cut it. Other times the patients, just may be concerned about the cosmetic look of it. But I tell them this is a reservoir for infection, and over again, because the fungi in the nail can spread to the skin, and then as you get the athlete's foot, and then you get the infection in the groins, because it is spread from the foot to the groins. It also causes oftentimes infection between the toe webs of the toes, and then it causes cuts in between the toes. And from that, the problem is a bacterial infection can set in, and then patients present to us with cellulitis, which is infection of the skin with a bacteria, and that can be life-threatening if it's not treated properly in time. Oftentimes, patient comes in, they have some pain in their leg, it's red, it's warm, and it's painful, and the redness is spreading, and that's how we know cellulitis. It's important when the patient presents with cellulitis to check the feet to make sure they don't have a fungus. Because if they have a fungus, you want to treat that fungus so that you prevent the cellulitis in the future from coming back. In addition to cellulitis you're going to treat now, you want to go to the roots of it to make sure that you're going to help them prevent this problem in the future. Then another kind of fungus that's very common is in children, especially dark skin. African Americans are very prone to fungus on the scalp, on the head. What we call they have oftentimes a spot of hair loss, and some scaliness, maybe some redness, and that is a little bit more long-term treatment. Oftentimes, you need to treat the patient for a couple of months. You need to give him medication by mouth to help it. And it is contagious, so we advise the patient not to share pads and combs and stuff with other siblings. Oftentimes, the school wants us to send them a note that the patient now can go to school, and they're strict in some places about that. But if the patient has been treated for 1 week with antifungal properly, then we can tell them, yes, you can go to school after 1 week. It should be okay. But the full course of treatment could be anywhere between 4 to 8 weeks to get it cleared up.
It looks like a fungus, and that whole thing needs to be treated not only for the local discomfort and pain and bad look and all those things, but it's obviously something which infects the whole body.
It can affect other parts of the body, yes. If somebody's immunity is very, very weak, people who have diabetes, people who are post-transplant or on medication to help with the immune system, they're much more prone to get fungal infections. So that's something that has to be dealt with more aggressively and in a more timely fashion.
Mm-hmm. Right. Well, all right. Here you have it. Let's get rid of fungus, and they are treatable. So let me ask you one more fast question here. A person who has let's just say an athletic foot, and is it okay for him to try over-the-counter, powders and stuff like that? Do they usually help? Or if it doesn't work right away, I don't know, within a few days, is that a sign that he needs more professional treatment, or what's the deal there?
Well, a lot of the over-the-counter medication may keep things at bay to some extent, but if you really have an infection, you need to be treated properly to get rid of it, and then you can use the over-the-counter powders and things to sort of prevent it from coming back in the future.
Okay, got it. Well, appreciate your candidness. Thank you very much, Dr. Ghatan.